So good morning, everyone. I'd like to start off by recognizing the governor for being an incredible partner in education and making our teachers a priority from day one. So thank you, Governor, for allowing this to happen. So I also want to recognize Dr. Alexander Scott, the Director of Rhode Island Department of Health, as if everyone here doesn't know you, but she's been working night and day to make this day happen when we can announce that we're going to be fully in person come September, everyone fully in person. Districts will not be required to provide distance learning, which is a bit of a shift. You know, this has been a really incredible year. As you all know, you've lived through it with us. But our teachers have risen to the occasion. Our nurses, our parents, our students, our principals, our superintendents, everyone in the education system, our bus drivers has gone above and beyond. When other states were trying to figure out how to create a calendar, we were already 10 steps ahead, and we intend to stay there. So our announcement today about being fully in person is really groundbreaking and really important for our system. So as we move forward, some of the things that will be different. Even though there will not be a requirement for distance learning, there will be some students that have medical issues or that when there are quarantines or illnesses, that districts have to have a plan for instruction happening through some sort of method electronically. Then there's also the ability to really look at those students that have medical issues that will work individually with the school district. The second piece that is really important for us is the busing. As you know, we struggled with getting our students on the busing. There is no longer going to be the mandate of the distancing of the numbers. So students, districts will be able to put the kids on the bus. However, masks will be required, continue to be required on the buses. Windows will be open, so that is a game changer for us. The other piece that is extremely for us will be that stable pods will continue to be utilized. And when not utilized, we will have 3 feet of distance is going to be recommended. We're also recommending that school districts create a mask policy for the students that are not yet vaccinated. As we know, vaccinations are only 12 and above. So any group that has not been vaccinated, there will have to be a policy within the school district. Teachers that have been vaccinated or students that have been vaccinated do not have to have a mask. So there will be a policy that each district will have. The LEA will be in charge of those policies that will be made clear to the community. So face coverings are required by federal law on the buses. I want to make that very clear because that has, the face coverings have been what we hear the most about. So we also are recommending that the LEAs adopt a 7-day testing quarantine requirement. What that means is that 7 days to quarantine and to come back have to have a test. So there has to be a test. However, the Department of Health has the discretion to have a longer quarantine if need be. Only close contacts of positive cases who are not vaccinated will be quarantined so long as adequate physical distancing was enforced. Longer quarantine lengths may be recommended in certain situations where there's more likely to be a sustained outbreak. We will continue to work in partnership with public health experts and the governor's office and the remarkable school leaders that have been doing this work. So today is an amazing day. We look forward to our kids being back in the school building and enjoying each other's company and learning the way that we know that our kids need in person with their teachers and in their environment with their colleagues.